Well, good afternoon, everybody. And today is our briefing for December the 23rd. It also is, of course, right before Christmas Eve and Christmas. And I want to start by wishing everybody a happy holidays, Merry Christmas, of course, for those that celebrated Hanukkah, and any celebration that we have during this time. I just want to wish everyone the absolute best. I want to also just make sure that folks know that we're going to have a full update today. We're also going to have our director of the health department, Kelly Colopy, is actually phoning in to do her update. That will be right after mine. And of course, we have translation, and then at the end, we'll have also our Spanish translation, as we always do. And there'll be an opportunity for the press to ask any questions as well. And so that will all happen. And let me just begin by giving some overall numbers and data, and then walk you through a couple slides about where we're at, and really the seriousness of where we're at. And then we'll turn it over to our health department as well. So let me begin just by saying that as of today, there's 170 Long Beach residents that are currently hospitalized due to COVID-19. They could be, of course, at our local hospitals. On occasion, there are a few that are at some other hospitals, but of Long Beach residents, there's 170 in hospitals. And we have over 1,000 positive cases since yesterday, actually 1,002. Sadly, both are record-breaking data points. And so the COVID crisis in Long Beach is not getting better. In fact, it's getting worse. Now, since the beginning of the pandemic, we've had 27,719 Long Beach residents that have tested positive overall. We, of course, know that almost 20,000 of them have recovered, but that number continues to grow every day. Now, yesterday, the city reported that we had reached a really horrific milestone. We reported 14 deaths in just one day. That is the single largest number that we have reported since this pandemic started, and it doubled the previous record that we had set before, just not too long, weeks before that. What's also disturbing about that is we're reporting today 8 fatalities that happened just in the last day. That's now the second highest number of deaths that we've had. And so the highest number of deaths and the second highest have just happened in the last 2 days. And what's really frightening about that is we are just beginning to see the impacts now of folks that are hospitalized due to the Thanksgiving holiday, which I'm going to talk about in just a minute. Now, we've lost a total of 341 residents to COVID-19 in Long Beach. And there has been no moment in our city's history, not one, where we have lost this many people and devastated this many families in the history of our city. Not the earthquake in the 1930s, not a year where we had a crime spike in the 1990s. This is the single biggest threat we have faced ever to life, and it's the single biggest threat we have to life in our city in the future. And quite simply, I think we have to just recognize that we are living through the biggest challenge that we have ever faced as a community and as a city. That's how serious we find ourselves in. That's the level of seriousness that we have to take the crisis that's in front of us and plan for it every single day. Now, I want to note that it's awful to know that our health department has had to activate our mass fatality plan, and we're nearing capacity at our local morgues. The virus is devastating families, and there has been loss all across the city. My prayers and love go to everyone that's lost somebody. I understand what that loss feels like, especially during the holidays, and we have to do everything we can to stay safe. I'm going to talk about our hospitalizations in a minute, but I want to first start with a little bit of what's hopeful. As you can see in this first slide that we're going to show you, we are now in the first phase of our vaccination plan. We are, of course, doing everything we can to get everyone vaccinated as soon as possible. Our first phase is called Group A, we'll call it 1A, but Group A for short, and that, of course, is all of our medical personnel at all of our hospitals, correctional facilities, and our skilled nursing facilities, retirement homes, paramedics, EMTs, dialysis centers, dentists, pharmacists, all medical folks in the city. We have now vaccinated about 34% of this group. What's really important, though, is that just today, we received 11,600 doses of the Moderna vaccine, which of course we had already received the Pfizer vaccine before. And so now we have received a total of 17,450 doses. And the second part of those doses, by the way, are on their way, and that's been secured already. But what we do expect now is that all of this group and all of our hospital and medical personnel will receive this first part of the vaccine in the days ahead. And so by the end of the year, we should have hopefully completed all of our hospital medical personnel, and we will have started all of our nursing facilities and our skilled care facilities as well. So this is really good news, and we want folks to know that in that first week of January, we expect everyone that's a paramedic and an EMT to also begin receiving their vaccines, and begin moving to the essential worker category, which is Group B or 1B, in hopefully mid-January. If we remember correctly, that group includes our teachers, it includes essential critical workers at our grocery stores, it includes our transit operators, it includes folks that are cleaning our streets, many of our city workers as well. I now want to turn to our next graph, and as we move from the vaccine to where we are. As you can see in this slide, new cases are continuing to climb since the Thanksgiving holiday especially. On average, our number of new cases went from 47 per day on November 1st to 622 on December 18th. Now that's an increase of over 1,000%. We also need to understand that currently our 7-day positivity rate is 14.4%, and our case rate is 124.2% per 100,000. Now, what's really concerning about this slide, the second slide, is that we are now seeing right now the impact of our hospitalization rate from what happened over in Thanksgiving. And you're going to see that in the hospital trends in just a minute. But that case rate is impacting those numbers. If you go to this next slide, which is our confirmed cases by age, you can also see this is no longer a pandemic that's only affecting our seniors and those that are older with more underlying health conditions. We look at the cases confirmed between the ages of 20 to 29. This is now a young person's virus and a young person's challenge. And so we know that folks in their 20s and in their 30s are spreading this at a quicker and faster rate than anybody else. And unfortunately, many of these folks are asymptomatic and are transmitting COVID-19 to their grandparents and to other family members, some of who are then dying in our community. So look at this hospitalization trend in this next image. And we know that hospitalizations, of course, are an indicator of how many people are really feeling the worst of COVID-19. And we know that hospitalizations increase and begin to increase about 2 weeks after a surge begins, and then that deaths typically follow 2 weeks after that. So I want to give you an example. It's a hard one, but it's one that I think is important on this note. Let me use my mother as an example. So my mother, when she first contracted COVID-19, when she was exposed, she went and took a test a few days later, and she tested positive. For about a week, she had very light symptoms, and the symptoms got a little worse over time. Then 1 week later, that at the end of that week of where she had symptoms, she was hospitalized. She actually was in the hospital for 3 weeks before passing away. And so there is a direct correlation with the deaths that we are having and seeing, the 8 we had yesterday and the 14 we had the day before, that are directly related to what was happening over that Thanksgiving holiday. Because what the impact of Thanksgiving is now happening today. And I say this because we will see the impacts of Christmas Eve and Christmas, not next week, not the first week of January, but we will see those deaths, and many of those deaths, not until mid to end of January. And if you compound that holiday with then what may happen on New Year's Eve and on New Year's Day, what we're headed towards is a catastrophic event at our hospitals. And the only people that have the ability to stop this catastrophic event are each of us individually that have to make the right decision and make the right choices. So look at this slide that we're looking at right now, and you can see the enormous increase that has happened. Our hospitalized residents have dramatically increased. Our Long Beach area hospitals are seeing record-breaking numbers. I also earlier today spoke with one of our leaders at one of our hospitals here, St. Mary, and they are struggling. Their doctors and their nurses are pleading for your support. They are seeing more and more and more patients every day, and they're doing everything they can to provide excellent care. But this is an issue of just space. We have the overflow capacity. That's not the issue is capacity and the amount of people to serve. And so I want everyone also to know that at the time when my mom was in the hospital, I felt fortunate that we weren't at a big surge. And I think my mom probably received pretty good care. And there were plenty of nurses to go around and see folks because the patient number was much smaller. Where we're headed is a situation where nurses and doctors are going to have to make the choice about spending less time with your parent and less time with your grandparent because they have too many patients to see. And so doctors and nurses are going to start triaging who can they help and who needs help the most in that moment. And that's someplace we don't want to end up. And so I think that you're reading about this in the press and in the media. What they are reporting is true. We are in a serious place with our hospitals, and folks need to do better. And if you look again at this slide about ages of who's in our hospitals, I remember when that slide used to be a majority of folks that were over 80 and in their 70s. And as you can see, look at that 40 to 64-year-old category. This is affecting everybody. Also want to talk about ICU capacity at these hospitals. So if you look at our capacity, we have surge capacity and we're implementing that. We've got actually 333 surge beds available. The critical issue is ICU capacity. Regional ICU capacity is at 0%. Statewide capacity is at 1.4%. If you look at that same methodology, our Long Beach area hospitals are at 1.5% capacity. So we are near having our ICU hospital beds full at our 5 Long Beach area hospital system that we track. And of all of our ICU beds that we have, about 62% of them are COVID related. And please don't forget that not everyone that goes to the hospital has COVID. So all the other ailments and accidents that people experience, they still need hospital access. If you have a heart attack or get in a car accident or are a victim of domestic violence, those folks need help in our ERs and our ICUs oftentimes as well. And now there's also less room for them. And so you may be very careful and you may not get COVID. But there could be something else that could happen to you or a child or a family member that could put you in the hospital where we almost have no ICU beds left available. And so we'll continue to do everything we can to support our Long Beach area hospitals. And we are, of course, working directly with the state and others to increase that surge capacity that's available and where we can. Finally, I just want to remind everyone about the next few days. Thanksgiving, like for many of you, I relate. It was very hard for some of my family members to not see me over Thanksgiving, and hard for them to understand why I stayed home and spent just time with just me and Matthew. And sometimes they were, many of them were hurt that I wouldn't see them, especially after a year that our families had so much loss. But it's important for us to sacrifice and also explain to our family members why it's dangerous to do so. Over the next few days, I will be at home with Matthew, alone, on Christmas Eve and on Christmas and in the days after. And while there's many members of my family that would love to see us and spend the time together, that's not happening this year. And so I would also encourage folks to do the same. Model good behavior, stay at home, and know that one of your family members could end up in the hospital because of what you did on Christmas or Christmas Eve, and there may not be a bed waiting for them at the ICU. So I'm not going to take that risk, and I hope no one else takes that risk either. It's a tough choice, but it's also the right choice. We got to save as many lives as possible. And once we get past all of this, we have the job, of course, of rebuilding our economy and all the work that happens ahead. So I know this is sobering, but it's a serious challenge. I'm also very hopeful that the vaccines are here. So I'm going to turn this over to our health director, Kelly Colopy, who's also going to give an update, and then we'll also answer some questions. Thank you.
Thank you, Mayor. Go ahead, Kelly.
Thank you, Mayor. So as Mayor Garcia shared, we are in a very difficult time right now. Each day, as your health department director and Dr. Davis, your health officer, whenever we see the numbers come through, we kind of hold on to see what they're going to look like, and that just keeps getting rougher. And this week has been really particularly devastating. We've lost 26 people already, and it's only Wednesday. And in our average, around Thanksgiving, we had maybe 5 people. We had 5 deaths in a week. So we're at 5 times that number now. And I find myself sitting in loss for these families and for our city, and also knowing that so many more are in our hospitals and they're struggling during what should be a celebratory season. We received the most recent numbers for today, and we now have 400 people who are hospitalized. Over 100 of those are COVID patients in the ICU, and another 300 in our regular hospital beds. So those numbers are increasing, and they're increasing by 20 to 30 a day from what we're seeing right now. But in this space, we also do have hope as our additional vaccine arrives in our city. Had pictures from our team this morning as the FedEx truck pulled up to our health department to deliver the Moderna vaccine, and that vaccine will be utilized to help vaccinate our school district members, to our frontline workers, our essential service workers. So we're just really excited about the opportunity and the hope that this first step brings in starting to turn the curve of the virus. So yesterday, our hospitals did receive an additional shipment of Pfizer vaccine. So they got their first shipment last week, and they received more early this week. And then early this morning, the Moderna vaccine was delivered to area hospitals as well as to the health department. So the area hospitals, the total was 11,600, and the health department received 8,500 of those doses. Hospital personnel will continue to get vaccinated, and we will expand to additional groups in the first tier, such as our long-term care facilities, both staff and residents. There are people who are apprehensive about the vaccine. I get a lot of questions. There's a lot of misinformation. There's a lot of sort of conspiracy theory. I understand there's just so much mixed messaging. Please know that both Moderna and Pfizer vaccine have gone through rigorous testing and clinical trials before being approved for this emergency use by the FDA, and they've determined it to be safe. I do understand that there is a history. There's a history of racial abuse in our scientific community. There's a mistrust of big pharma. There's a mistrust of government in many places, and that makes it difficult sometimes for people to trust this process. But those feelings are they're real and they're valid. No one should feel any shame about the skepticism. But what I want you all to know is that Dr. Davis, myself, the public health and medical professionals across the globe have looked at the evidence. They've weighed the benefits against the risks, and they find the risks really to be limited, and that they're very confident in our recommendation for widespread vaccination and are hopeful for the positive impact that the widespread adoption will have for our individuals, families, communities, cities, and our nation. The good news is that while there are individuals who are skeptical, there are many, many that are eager for their turn. And so, we continue to work, we continue to answer questions to provide the most up-to-date and accurate information on these vaccines. And for those who have received the first round of their vaccine this week, I applaud you for taking this measure to protect first yourself, but also your family, your patients, and your community. In time, the vaccine will be available to more groups in Tier 1, and then moving into late spring to our general public. But even with some individuals getting vaccinated over the next several weeks, it remains critical that we continue with the precautions that you've heard us discuss over and over again, because it takes about 70% of people in the city of Long Beach to be vaccinated before we get to the point of what we consider herd immunity. So it is so important for all of you to please, when you have this opportunity, to please take it. So I'd also like to share a little bit more about our city's testing efforts. Testing remains a top priority, and our testing centers have continued to see record numbers of people each day. During the summer, much smaller surge, we were testing maybe 1,800 in a day, a record maybe 1,900. We tested over 4,800 people on Monday, and yesterday, 4,307 people across the city. So the test sites are operating, the appointments are available, new appointments come online every day. Some people are walking up, but we do encourage, things move much faster if you have an appointment. And then that guarantees that you will be able to receive your test. Some people are coming without appointments, and we do what we can, but it does push the capacity of our ability to test people, and we want to make sure that people who have appointments are able to get through quickly. Tests can be scheduled online or by calling the city's information line at 562-570-info. So that's 562-570-4636 between 9 a.m. and 5 p.m. on weekdays. Our testing sites will be closed on Christmas Day, December 25th, and on New Year's Day, and we'll be testing available until 1 p.m. at the city-run locations on Christmas Eve, so on tomorrow through 1 o'clock, and then also on New Year's Eve. We know that people want and need to get tested because people are infected, and there are more and more people with symptoms who have been exposed. But we also know there's a lot of folks who share that they are coming they're getting tested to make sure they're clear so that they can gather or to travel for the holidays. We want to remind people that getting a negative test result just means that you didn't have sufficient virus to be detected by the time of the test. So at that time, but it could be by the time you travel or gather that is actually not the case anymore, and that you could be asymptomatically exposing those around you. We like to remind folks that 50% of transmission comes from those who are asymptomatic or pre-symptomatic. So while we understand the feeling of safety when you test, it is not an absolute, and we ask you to please continue, even if your test says negative, to not gather with your friends and family. We are in the middle of this massive surge, and we're doing what we can to slow it down and make things better, but we can only do it if everybody is proactive in slowing it down with us for the common good of our city, our community, and our businesses. This means making the hard choices. It means not being with people. But there are ways to connect and to experience togetherness, to show love and support that don't require gathering in the same physical space. Pick up the phone, leave notes, FaceTime or Zoom. All these different ways are ways of connectedness, and I encourage all of you to engage in that for sure through these holiday times. So I know it's tough, I know it's a huge sacrifice, but these are steps we have to take to stay home, and as much as possible, wear your masks, follow all the things we keep telling you. And thank you for your support through this difficult time. And with that, I'm going to turn it back to the mayor.
All right, thank you, Kelly. We will now move on to media questions. As a reminder, we have time for one question each. If media has additional questions, they can contact the Long Beach Joint Information Center. First question comes from Kelly at the Long Beach Post. Go ahead, Kelly.
Hi there. Thanks for taking our questions, and happy holidays to you guys. This question is for Kelly. Is there any sort of ramped up type of enforcement or anything the city is planning on doing as far as enforcement, especially for over this holidays?
So we'll continue to be working with our venue task force and others, doing everything that we can. It's very difficult to enforce people gathering at home. And so this is something that we are just, asking people to do. that we do under this state stay-at-home order or safer-at-home order. Most of the businesses will have very reduced capacity or not be open, and so in any other space, we're really asking people to just to follow the guidance.
All right, next question comes from Haley at the Press Telegram. Go ahead, Haley.
Hi, my question is about the vaccination rollout. Mayor Garcia mentioned that 34% of people, I believe, in Group 1A have been vaccinated. So can you just share how many people are in 1A, how many people are in 1B, and how long you think it'll take to administer the second doses for these people?
So
Kelly, you probably have most of the details on that.
34% of those who are working at hospitals. That is the number that has been vaccinated. So not the whole Group 1A. The system that will be working, so CVS and Walgreens are engaged in a program where they will be bringing the vaccine to our long-term care facility staff staff and residents. So they will be, there is a state allocation specific to that population that they'll be engaging in, and then we go from there. I actually don't have off the top of my head the number that is in the in our hospitals, but the 34% is of our hospital of our our healthcare workers, and then we go from there. We do foresee that our fire department, like the EMTs, outward facing, will begin in the beginning of January, and then we continue to we will be moving into Tier 1B, so essential workers, by mid-January, and we'll be working with businesses and our community to make sure that those folks know when it is their turn to be able to be vaccinated.
All right, next question comes from Jeremiah at the Long Beach Post. Go ahead, Jeremiah.
Hi guys, thanks for taking our questions. And I had one for the mayor. Mayor Garcia, I'm sure you've seen that recently we've had some high-profile examples of politicians and then even the Long Beach Police Department not following health officials' advice. And I just wanted to ask you about that. Why weren't, even as recently as November, why weren't city employees following COVID-19 guidelines? And yourself, as someone who suffered a terrible loss from COVID, and you're trying to model good behavior yourself, what's your reaction to that? And what would you say to people who think that's undermining your message today to stay home?
Well, I think that, first of all, everyone should be wearing their masks, and I think that for all folks, and I think you referenced one incident, but city employees in general, and really anyone, should be masked. And for those that are participating in risky behavior, that's not appropriate and not acceptable. We're in a massive pandemic. I think a lot of the issues around masking have been resolved. I think that they're new. The city has had to, over time, put in more and more policies and stricter guidelines to ensure everyone from police officers to folks that are doing code enforcement to street sweeping are masked. And so it has not been a perfect process, and there have been a lot of learning that's gone along the way. I think that masking among not just city employees, but amongst the public is actually probably better today than it's probably been in this whole pandemic. I just hope that continues. And I think it's important for us to be able to, when those incidents happen, to ensure that they don't happen again and don't continue. And so on the issue with PD, I've had numerous conversations with the chief of police. He's very aware how personally upset I was about it, and has made those changes, and I applaud the department for making those changes. I think more broadly, the issue of masking has been also very politicized, and so it's hard to have a message where I might be saying wear a mask, but another government official might be saying that you don't need one, or that you can gather without masks. And so there is a lot of mismanagement of the message that has happened. And so as much as I can say my piece, I also don't always have the loudest microphone or the loudest megaphone. There are other government officials and people in positions of authority, including the president, that has oftentimes a different message. And so it is not as easy as me just saying, wear a mask, and everyone wears one. It is, unfortunately, we are in a communication disaster when it comes to masking in this country, because a lot of folks are not encouraging it, or certainly not showing good behavior. So that's I think one of the broader issues, but I think things are better now.
All right, next question comes from an email from Joe at the Signal Tribune. Question is, how many ICU beds do hospitals have cumulatively? Kelly?
So we have a total of 182 ICU beds across the Long Beach area hospitals. So that includes Memorial, Miller's Children, College, the Lakewood, Los Al, and St. Mary's.
All right, and the last question comes from Brandon at the Long Beach Post. Go ahead, Brandon.
Hi, everyone. Thank you for taking our questions. I also have a question for the mayor. Our hospitals are overwhelmed with some patients being treated in hallways, we're hearing. The community hospital operator claims to have completed all state requirements to reopen, but that has not been approved yet. Have all the requirements been met? If not, what still needs to be completed? And most importantly, what is the city doing to pressure the state to open that facility immediately?
The community hospital is from what I understand, it's in its final checklist. They've had actually multiple visits to the hospital, and very recently, actually, as of, I believe, just as of this last week, also we're finishing those last checklist items. You know, the city doesn't license hospitals, so we do everything we can to support, but that's the job of the state, between the state and the provider. What we're engaged in is, as recently as today, I have put in messages and encouragement to the state to get the hospital licensed. Of course, they've got to follow their rules, and the hospital has got to meet those rules. But I'm very, very hopeful. I mean, this should have happened a long time ago, so I'm just very hopeful that it happens soon. I keep hearing that we are close, that it could be next week, it could be early next week, but that's just a decision that is out of our hands, and that's completely going to be up to the hospital and the state. I will tell you that all of the major issues in reopening the hospital have been addressed, from what I understand. So there are some minor issues on that checklist.
All right, that concludes questions, and now we will move on to Spanish interpretation.
Muy buenas tardes. Hoy esto es nuestro comunicado de prensa para miércoles 23 de diciembre de 2020. Empecemos con datos generales. Hasta el día de hoy, ahorita, tenemos 170 residentes de Long Beach que están hospitalizados debido a COVID-19 y tenemos más de 1,000 casos positivos desde ayer. Lamentablemente, ambas son notas haciendo récord de solo un día. Desde el comienzo de la pandemia, 27,719 residentes de Long Beach han dado positivo por COVID-19. Aproximadamente 19,927 personas se han recuperado y ayer alcanzamos un número alarmante informando de 14 nuevas muertes, la mayor cantidad de muertes que jamás hayamos reportado en un solo día, duplicando el récord anterior de muertes reportadas en un solo día que fue establecido hace 8 días de 7 muertes reportadas el 14 de diciembre. Hoy ya se han informado de otras 8 muertes. Nuestras muertes semanales son 5 veces más altas que a finales de noviembre. En total, hemos perdido a 341 residentes aquí en Long Beach por COVID-19. Esta semana, nuestro Departamento de Salud activó su plan de fatalidad masiva y nos estamos acercando a la capacidad en nuestras morgues. Este virus está devastando a las familias y desafortunadamente más familias van a pasar por esto teniendo un ser querido en el hospital y pérdidas durante los próximos días y semanas si no nos quedamos en casa tanto como sea posible y seguimos esa orden de más seguro en casa. El alcalde mencionó que ningún otro evento en la historia aquí de la ciudad de Long Beach, ni el terremoto de 1930, ni la violencia que estaba incrementada en los 90s, tomó tantas personas aquí, tantas fatalidades como esta pandemia. Por favor, tengan cuidado. Mostraron la primera imagen, que es la plan de las vacunas. Hay buenas noticias y la semana pasada comenzamos a administrar la vacuna de COVID-19 a nuestro personal de hospital aquí en la ciudad de Long Beach. Hemos podido vacunar a un 34% de nuestros trabajadores de primera línea, enfermeras, doctores, los profesionales de la salud en nuestros hospitales. Hoy recibimos 11,600 dosis de la vacuna Moderna, además de 1,950 dosis adicionales de la vacuna Pfizer que recibimos este lunes que acaba de pasar. Eso es un total de 17,450 dosis de vacunas que han pasado por Long Beach hasta ahora. El personal médico y hospitalario adicional recibirá la primera dosis de esa vacuna en los próximos días. Esas son buenas noticias, pero aún queda mucho más por camino que recorrer hasta que la vacuna esté ampliamente disponible para todos nosotros, los residentes aquí de la ciudad de Long Beach. Actualmente estamos en medio de una tasa de casos, capacidad de cuidados intensivos y recuenta de muertes que las vacunas por sí no van a poder mejorar. Queremos compartir una actualización sobre los datos más recientes disponibles sobre casos y hospitalizaciones aquí en Long Beach. Los casos nuevos continúan aumentando después de las vacaciones de Acción de Gracias a finales de noviembre. Nuestro número promedio de casos nuevos pasó de 47 por día el 1 de noviembre a más de 622 para ser exacto, el 18 de diciembre. Eso es un aumento de 1,223% de incremento de 47 personas el 1 de noviembre a 622 nuevos casos por día. Y aunque no nos centramos en los niveles del plan estatal para una economía más segura, porque estamos sujetos a restricciones regionales, vamos a compartir nuestros indicadores locales. Actualmente nuestra tasa de positividad en 7 días está al 14.4% y nuestra tasa de casos es más de 124 por cada 100,000. Los números impactados por el Día de Acción de Gracias. El alcalde mencionó que se tarda varias semanas para que se vean los problemas con esas reuniones. A finales de noviembre, cuando la gente se reunió para ese fin de semana largo de Acción de Gracias, normalmente toma casi una semana para que muestren los síntomas y aquellas personas que tengan problemas más complicados y severos y necesitan ir a un hospital, normalmente pasa la segunda o tercera semana. Entonces, ahorita en diciembre, eso es lo que estamos viendo, los resultados de esas reuniones sin máscaras a finales de noviembre. La imagen 3 que se mostró son los casos confirmados por edad. La mayoría de las personas con COVID confirmados desde principios de noviembre tienen entre 20 y 59 años. Pero tomen en cuenta que la mayoría son en sus 20 y 30 años. Las personas de 20 años representan el grupo de edad en el que estamos viendo la mayoría de los casos en este momento, seguidos por los de 30 años. Esto ahora es un virus de adultos jóvenes, muchos los cuales no tienen síntomas y están enfermando a sus seres queridos como sus padres y sus abuelos. Están impactando las reuniones y lo que queremos prevenir es otro impacto para las reuniones de Navidad que si sigue las reuniones como van, se van a ver esos problemas en enero, ya que las camillas disponibles en los hospitales, especialmente esas unidades de cuidados intensivos, están a 0%. Las hospitalizaciones son un indicador de cuántas personas están experimentando enfermedades graves causadas por este virus. Sabemos que estas hospitalizaciones aumentan aproximadamente, como mencioné anteriormente, 2 semanas después de que comience un aumento repentino, y las muertes generalmente siguen 2 semanas después. Desde el Día de Acción de Gracias, la cantidad de residentes de Long Beach hospitalizados con COVID-19 aumentó de 67 a 170, aumento de 129%. Habrá menos atención médica si estos números siguen subiendo. Lo que va a pasar es que, aparte de las camillas, también el número de doctores y enfermeras no va a aumentar. Y hemos mencionado esto anteriormente. Aunque agreguen camillas, no podemos agregar doctores y enfermeros que van a poder darle la atención que usted como paciente quizás necesite. La imagen 5 mostró los casos hospitalizados por grupo de edad. Son los casos hospitalizados de residentes de Long Beach por grupo de edad. Como mencioné anteriormente, aquellas personas en sus 20s y 30 son los que tienen la mayoría de los casos positivos, seguido de cerca por los de 65 a 80 años. Junto con el resto de la región, estamos experimentando una escasez crítica de capacidad, principalmente debido a la dotación de personal. Nuestro uso general de camillas es de 67% y tenemos 333 camas adicionales disponibles. Sabemos que lo fundamental en este momento es nuestra capacidad de las unidades de cuidados intensivos. Tomen en cuenta, por favor, que cuando hablamos de estas camillas, no solo son para pacientes con COVID-19, sino también para cualquier persona que tenga una enfermedad severa o grave, como un ataque al corazón, un accidente, víctimas de violencia doméstica que quizás necesiten también atención. La capacidad de las unidades de cuidados intensivos en los hospitales de la región está al 0% y la capacidad en todo el estado está a 1.4%. Según la misma metodología, los hospitales de nuestra área de Long Beach tienen una capacidad de 1.5%. El 62% de los que están en nuestras camillas de las unidades de cuidado intensivo son pacientes con COVID. Así es que también tomen en cuenta que todos los servicios que normalmente se necesitan cuando no estamos en pandemia, esos pacientes todavía van a requerir asistencia. Entonces es importante recordar que la capacidad de las unidades de cuidados intensivos no se trata solo de tener camas y personal para apoyar a los pacientes con coronavirus o COVID-19, sino también de permitir brindar atención para otros tipos de problemas. Estamos haciendo todo lo posible para ayudar a los hospitales de nuestra zona. Hemos desplegado nuestros hospitales de campaña móviles en Long Beach Memorial Medical Center y también College Medical Center, a pedido de ellos para ofrecer capacidad adicional. Queremos recordarles que nuestras acciones pueden prevenir las muertes, hospitalizaciones y casos positivos de COVID-19. Hoy nos acompañó la directora de salud, Kelly Colopy, y ella informó que esta semana ha sido particularmente devastadora. Ya hemos perdido a 26 personas esta semana y solo es miércoles. Informó que se encuentra triste por estas familias y por nuestra ciudad en la situación en la cual estamos, y también sabiendo que hay muchas más en nuestros hospitales luchando durante lo que debería normalmente ser una temporada festiva de celebración. Pero en este espacio también tenemos la esperanza a medida que lleguen las vacunas de Pfizer y Moderna a nuestra ciudad. Ayer nuestros hospitales recibieron envíos adicionales de las vacunas. Y esta mañana temprano recibimos, como mencionó anteriormente, la vacuna de Moderna que se va a estar dando a esos profesionales de primera línea. El personal del hospital continuará vacunándose y nos vamos a mover a otros grupos adicionales en el primer nivel, como nuestras instalaciones de atención a largo plazo, tanto el personal también como los residentes que viven en esas localidades. Para aquellos que recibirán la primera ronda de su vacuna la semana pasada, los aplaudo de ella por tomar esta medida para protegerse primero a sí mismos, pero también a su familia, sus pacientes y su comunidad. Con el tiempo, la vacuna estará disponible para más grupos en el nivel 1. Recuerden que hay varias etapas, nivel 1A, 1B y 1C. Y finalmente vamos a llegar a un tiempo cuando va a estar disponible para el público en general. Incluso con algunas personas que se vacunen durante las próximas semanas, sigue siendo fundamental para nosotros continuar con las precauciones que nos han estado diciendo durante estos últimos meses. Las pruebas de COVID-19. Las pruebas siguen siendo una de las principales prioridades y nuestros centros de prueba aquí en la ciudad de Long Beach continúan recibiendo un número récord de personas cada día. Ayer la ciudad evaluó a 4,307 personas para COVID y el lunes hicieron 4,800 pruebas. Las pruebas se pueden programar en línea o llamando a la línea de información de la ciudad al 562-570-4636 entre las 9 de la mañana a 5 de la tarde los días lunes a viernes. Nuestros sitios de pruebas estarán cerrados el día de Navidad, el 25 de diciembre, y el día de Año Nuevo, que es el 1 de enero. Y las pruebas estarán disponibles hasta la 1 de la tarde en ubicaciones administradas por la ciudad en Nochebuena, el 24 de diciembre, y la víspera de Año Nuevo, el 31 de diciembre. Sabemos que la gente quiere y necesita hacerse la prueba porque hay más personas infectadas y cada vez hay más personas con síntomas o que han estado expuestas. Pero también sabemos que hay muchas personas que se están haciendo la prueba para confirmar que están negativos y reunirse durante las vacaciones, durante Navidad y Año Nuevo. Queremos recordarle a todos ustedes que así no funciona. El virus puede tardar varios días hasta una semana para poder desarrollar suficiente para salir positivo en su prueba. Si usted toma la prueba hoy y sale negativa, no significa que usted no tiene el virus. Quizá pueda ser que el virus solamente no ha crecido suficientemente para poder salir en esa prueba y puede, si se junta con otras personas, infectar a otras personas. Estamos en medio de la oleada y estamos haciendo todo lo posible para frenar esto y mejorar las cosas, pero requerimos de su asistencia. Recuerden que pueden pasar un par de días de que una persona que esté infectada para que la prueba pueda detectar ese virus. Así es que una prueba negativa no confirma el 100% que usted no tiene el virus. Es muy difícil durante este tiempo pedir que todos nosotros nos quedemos en casa y no estemos reunidos con otros familiares. Mencionó el alcalde que él se va a quedar en casa con su pareja, con su esposo, y no va a estar con el resto de su familia. Aunque muchos de ustedes quieran reunirse con familia y amigos, pedimos que no lo haga y que en vez levante el teléfono, deje notas o haga un cara a cara por Zoom. Esto es tan importante. Kelly Colopy quiere también decirles que sabe que esto es muy difícil, es un gran sacrificio, pero estos son los pasos que debe uno seguir para quedarse en casa lo tanto que sea posible, así como para usar su máscara, lavarse las manos y tomar todas esas precauciones de las cuales hemos estado hablando durante los últimos meses, desde marzo. Esto es todo por hoy. Muchas gracias por acompañarnos. If you've just joined during our Spanish translation, please visit our Facebook or Instagram page to see our briefing in English from the beginning with Mayor Garcia and our Director of Health, Kelly Colopy. Felices fiestas and happy holidays.